Low-grade serous ovarian cancer is a rare subtype that accounts for less than 10% of all ovarian cancers. Unlike its high-grade counterpart, low-grade serous ovarian cancer grows slowly, but is equally as invasive. What makes it particularly significant is that it affects younger women. The average age of diagnosis for low-grade serous ovarian cancer is 45, compared to the overall average age of 63 for ovarian cancer. This means low-grade serous ovarian cancer patients face unique challenges like infertility, early onset menopause, and balancing treatments with raising families and careers. Its cells more closely resemble normal tissue, making it extremely hard to detect at early stages. Scientists are still piecing together exactly how low-grade serous ovarian cancer can develop. We know it may originate in the fallopian tubes or ovaries, and some studies suggest that it could develop stepwise from borderline ovarian tumors. What distinguishes low-grade serous ovarian cancer are specific genetic mutations. About 60% of LGSOC tumors have either a KRAS or a BRAF mutation. This creates a unique genetic profile different from other ovarian cancers. However, around 40% of these tumors still do not have any genetic mutations, which makes treating and understanding these cancers particularly challenging. This genetic complexity is why targeted research is specifically important for LGSOC. The differences between low-grade serous and high-grade serous ovarian cancers are significant. Under a microscope, LGSOC cells still somewhat resemble normal cells, unlike HGSOC cells, which are highly abnormal. LGSOC grows slowly and steadily, while HGSOC grows aggressively and quickly. LGSOC often has KRAS and BRAF mutations, while HGSOC commonly shows BRCA and TP53 mutations. Perhaps most important for patients, LGSOC usually responds poorly to chemotherapy treatments, unlike HGSOC, which has a higher response rate to chemotherapy. LGSOC generally has a higher prognosis, with a median survival of 82 months compared to HGSOC's median survival of 58 months. Surgery is the cornerstone of LGSOC treatment. It's essential to removing as much visible tumor as possible. Unfortunately, standard chemotherapy shows limited effectiveness against LGSOC, with much lower response rates to HGSOC. Hormone therapy, particularly aromatase inhibitors that block estrogen, are a common frontline or second-line treatment for LGSOC. Targeted therapies like MEK inhibitors and BRAF inhibitors are emerging treatment options on the horizon. The most exciting recent development is the FDA approval of avutometinib and defactinib, a treatment line option specifically created for KRAS-mutated recurrent low-grade serous ovarian cancer. Recurrence is unfortunately common with LGSOC, affecting over 80% of patients with advanced stage disease. Low-grade serous ovarian cancer can reappear many years after initial diagnosis. When recurrence happens, management options can include surgery if possible, or systemic treatments like hormone therapy or targeted drugs. Each recurrence requires an individualized approach, balancing treatment options and quality of life. An LGSOC diagnosis can bring a unique set of challenges for younger women who are balancing cancer with family and career obligations. Building a strong support network is essential. This can include professional counseling, support groups, and online communities with others facing this diagnosis. Open communication with your medical team is crucial. Don't hesitate to ask questions or advocate on your own behalf. For younger patients, fertility preservation is an important conversation to have early. When possible, have the conversation around fertility-sparing surgery. Throughout this journey, remember that while low-grade serous carcinoma is rare, you're not alone. Learn more at nottheseovaries.org.